Good afternoon, everyone. It sounds like we're going to get started. So before we do, just a few points of order. So just a reminder that this summit is not just about talking, it's about taking action. So when you're listening to these presenters, think about climate actions that you can take as these breakout sessions progress. And then it's definitely supposed to be engaging, like let us know what we'll be discussing. And then we're also going to be saving some time at the end to allow for audience questions. So if you have anything that you are really curious about, please keep that in mind and ask that at the end of the presentations. All right, and then one of the key themes of this is also collaboration. So we're going to be hearing from a variety of different speakers, different parts of, government organizations and partners who are working in climate change. So think about ways that you could collaborate and be creative. Think about some non-traditional opportunities here. During the coffee break and before the next session, there are also the large boards in the lobby and in Wiseman B that are interactive and can highlight ways that you can interact with climate change. So take a look at the booths out there. And then the next breakout session should begin at about 1:40. Okay. So we'll start with some speaker bios. My name is Jake Riley, and I'm going to be moderating this session. I graduated from the University of Iowa College of Public Health with an MS in Epidemiology back in 2014. Since then, I've worked as a disease prevention specialist back in Iowa, focusing on communicable disease investigations, quality improvement, and public health accreditation. I had a big part in our response to the COVID-19 outbreak, and was even able to publish a paper on mask effectiveness in the Journal of Emerging Infectious Diseases. I was also a board member for the Iowa Public Health Association, which helped me expand my skills in strategic planning and public health advocacy. My partner Danielle completed her PhD in epidemiology in 2022, and that's what brought us out here to the DC area. We moved out here with our 2 dogs and have loved it ever since. I obtained a position as the senior epidemiologist at Prince George's County Health Department and currently manage the Office of Assessment and Planning. So I work with my team to support the data and planning needs of the agency, including program evaluation, special reports, quality improvement, strategic planning, and the community health assessment. So that's kind of how my work fits in with climate change. The team also supports the Prince George's Health Action Coalition. If you haven't heard of that, please look into it. We'd love to get more community participation. And we use data to inform and improve public health systems and increase engagement with community partners. And our goal is to better deliver on the health department's vision that all Prince Georgians are their healthiest at every age and every stage. Now for the important people, the speakers. So first we have Kim Rush Lynch, who serves as the program manager for the Prince George's Soil Conservation District's Urban Agricultural Conservation Program, where she leads efforts to support urban farmers in implementing soil and water conservation practices. In this role, Kim connects growers with technical and financial resources to adopt best management practices and helps them navigate complex local and state regulatory landscapes. With a deep commitment to environmental stewardship and food equity, Kim collaborates with a wide range of partners to advance conservation and urban agriculture. She's an active member of several key initiatives, including the Prince George's County Envirothon Program, Prince George's County Public Schools Environment, Agriculture and Natural Resources Program Advisory Committee, the Prince George's County Food Equity Council, the Steering Committee for the Urban Farm Incubator at Watkins Regional Park, and the Metropolitan Washington Council of Governments Regional Agricultural Workshop. In recognition of her leadership and dedication to equity in urban agriculture conservation, Kim was honored with the 2024 Maryland Civil Rights Award by the National Resources Conservation Service's Maryland Civil Rights Advisory Committee. When she's not thinking about food, which is rare, you can find Kim in her garden, at her local farmer's market, roller skating, or cheering on her favorite swimmer, her daughter McKenna. Up next we have Assistant Fire Chief Aaron White, who's been with Prince George's County Fire Emergency Medical Services, EMS, department since 2006 and has served in several leadership roles throughout his tenure. AFC White currently serves as the commander for the Office of the Fire Marshal, which includes the Fire Prevention and Life Safety Division, Fire Investigations Division, and the Bomb Squad. Last but not least, we have Nsedu Obot Witherspoon, MPH, who serves as the Executive Director for the Children's Environmental Health Network, expanding partnerships, organizing, leading, and managing policy, education, training, and science-related programs. For the past 23 years, she has served as a key spokesperson for children's vulnerabilities and the need for their protection, conducting presentations and lectures across the country. So as you can see, we've got a great slate of speakers up here, and with that, I will turn it up to our first speaker, Kim.
Thank you. Good afternoon, everyone. I appreciate the invitation to be here speaking with you today about the Bloom PGC initiative and our food security and climate resiliency heroes, our urban farmers in Prince George's County. We have a few of them here today. I don't know if some of our urban farmers I see in the audience could just wave or stand up. Please catch up with them today about some of the great work that they're doing. Again, I manage the Urban Ag Conservation Program with the Prince George's Soil Conservation District. The first question I usually like to ask is, is there a side arrow? Maybe I'll go this way. I'll hit the keyboard. When I hit the arrow, it went to the other one. Sorry about that. How many people here have heard of a soil conservation district? Okay, this is better than I usually. Okay, great, thank you. So that's good. So a lot of folks have not heard of a conservation district before, so that's usually a better reception than I usually get. For those of you who aren't aware of soil conservation districts, we have 23 in the state. There are over 3,000 soil and water conservation districts across the country. We are political subdivisions of the state, working with county, state, and federal partners. We are a conservation technical assistance agency, not a regulatory body, and we are self-governing, administered by a board of supervisors. And today, actually, we have one of our Board of Supervisors with us today. Denise, if you want to raise your hand, so if you have questions about the governance of a soil conservation district, Denise is with us today. So I'm going to get into a little more about our district's specific work. We have 5 signature programs. We have a Rural Ag Conservation Program. We also have an Ag Land Preservation Program that we administer, plus there's one for the county, and then there's 2 programs at the state level that we administer. We have an Urban Development and Conservation Program that reviews erosion and sediment control plans for new development in the county.
calls in 2023. The heat creates a better environment for mold, which exacerbates, asthma issues, and can also increase the development in children. So that's a very concerning number. Flooding and water rescues. So from 2023 to 2024, we went from 4,400 calls to 6,700 calls. So that's a nearly 170% increase in water rescue incidents. We also had a wildland fire incidents rose 475%. So in 2023, we had 238. In 2024, we had 506. In 2020, we only had 88. So again, from 2020 to 2024, that's a 475% increase in wildland fires. From 2010 to 2019, more than 80 people have died from extreme heat. Many of those in higher risk categories such as children, pregnant women, older adults, outdoor workers, and also those who are in the lower income areas. Due to the higher demands of energy, the rising cost of energy, they're reluctant to, turn on their cooling systems. And so the children in the beds are unfortunately passing away, and it's tragic. So we can also talk about rainfall. So we are anticipating from 2050 to 2079 a 2 to 3 inch increase in rainfall levels. And what that does is, as several speakers have mentioned, our systems are not designed for such heavy rainfall. So increasingly frequent, intense, and long-lasting torrential rain causes property damage, septic backups, declining well and stream water quality, and it's detrimental to the Chesapeake Bay because of all of the runoff, increased runoff. The heavy rain also overwhelms infrastructure and drainage systems, again leading to damage that we are not currently equipped to repair. So from a fire EMS standpoint, we do appreciate this conversation. It's the first time we've ever been asked to participate in something like this. We don't have an adequate climate lens at the moment, so we are glad to be a part of the conversation. We're glad to see that there is a great interest in it, as seen by switching from the community college to here at Bowie State because of the interest. So it will be good for us. This will lead to being able to upfit our stations. We have many stations that are decades old, very small, and they do not have the energy systems to keep up with the demand themselves. So as you know, that will negatively impact service delivery, which we greatly want to avoid. But increase in population on top of negative climate changes is a recipe for disaster. So we're definitely glad to be a part of this conversation. Some other stats. I think I went over those, and I apologize for the disorganization, but I think that's really all I have. From a stat standpoint, so some of the things that we're looking to do is again upfit our fire stations with energy efficient systems. What else are we looking to do? We're trying to, one of the bigger things is we have a lot of firefighters that live outside of the county, and the commuting, we're trying to make it, I should say the county administration has implemented legislation to make it a little easier for firefighters to live in the county. So that will enable more firefighters to actually live where they work and reduce the emissions from commuting. Among other things, those are some of the big things. We have an aging fleet that we are trying to update, more energy efficient vehicles, change the culture, because currently it's, the firefighters want the diesel engines, and that's what they're used to, and electric fire trucks just kind of blow their minds. But we are exploring all avenues to kind of modernize and, get with the times. So I'd be happy to answer any questions later on, but I appreciate your time. Thanks.
Thank you. And yeah, I love hearing about, connecting with non-traditional partners, hearing what they're doing in the climate space and some of these creative solutions. I never would have really thought of an electric fire truck either, so that's really interesting. And as a data person, it was really cool to see all of the data that they presented. I kind of spend my time thinking about infectious diseases and chronic disease, and not so much those like acute incidents that also have a huge impact on people's health. So it was really great to hear about that. And now we'll hear from Nsedu.
Thank you. Thank you so much. I've really appreciated. Thank you. Thank you very much. All right. I hope everyone's having a really informed day. I certainly am, and it's very encouraging. And as we were encouraged and challenged in the opening session, we have to continue to amplify how important the partnerships are. We need all of us all together, breaking down silos, but we do need to see continued action. There we go. So the Children's Environmental Health Network, we're a national nonprofit. We also do a lot of work on the global stage as well. We got our start out in California, but we are in DC since 2000. And I have been a resident of PG County for many years. I'm actually in Charles County now, but care a lot about this entire region. Happen to also be a mom of 4 and deeply, deeply passionate about making sure that our current and next generations are not reaping the worst of our inaction. Our mission has always been to protect all children from environmental hazards and now the growing threats of climate change. We lead what's called the Children's Environmental Health Movement, so we are working to prevent negative health outcomes by leaning on existing science, by stimulating science and research, but most importantly, people's lived experiences. You've heard continuously today, and you'll continue to hear how all of us can relate to being impacted by wildfires, flooding, the rising heat index, just to name a few, and certainly our kids are feeling the brunt of that. This is where we spend a lot of our time in public health and maternal and child health, looking at the chronic illnesses of children. And all of these chronic illnesses, all the increases, if we had more time, I would also add statistics, but looking at just since we've been keeping track, all the major chronic illnesses have at least 25 to 40% of an environmental link. So I'm just trying to help you understand some of the foundation that we're dealing with for starters before we even get to the impacts of climate change. So we're talking about 1 in 4 children have their death, unfortunately, related to polluted environments around the world. That's the place we're at. Every child is born pre-polluted at this point. It doesn't matter how rich you are. It doesn't matter even if you're in Scandinavian countries. This is sadly where we're at. I'm going to pick us up, but I just want us to be transparent of where we're at. Looking at Maryland, 33% of children under age 18 in the state live in counties with F or D failing grades when it comes to ozone pollution. And that relates to a lot of our upper respiratory concerns, our asthma, and many other chronic illnesses that stem from that. Childhood asthma, about 7.4% in children 17 and under. And I will just tell you, unfortunately, our tracking across the country is not always the best. This is the best estimate. The point is I've been dealing with this for 25 years. We still are dealing with childhood asthma related to poor air quality. It's a huge part of the component of that chronic illnesses. And then childhood cancer. We do a lot of work in trying to prevent long-term illness. We know that there's about 4,000 cases of childhood cancer in Maryland alone. That's not behavior. That's not tobacco. That's not lifestyle. And that's not poor diets or alcohol or smoking. So there's other things happening here. That's just our baseline. So the impact of the climate crisis, we know that there could be no greater threat facing the world's children than climate change because it exacerbates all of the fundamental environmental injustices and exposures in the first place. And I would be remiss to not just make sure, we heard this earlier too, that there is a huge injustice within the climate and environmental spectrum. If you're already food insecure, housing insecure, You don't know where your next meal is coming from. What about child care insecurity? If you don't have quality, affordable child care, you pretty much can't go to work. Economically insecure and all the things. If you're already in that component, you are already sadly going to be even higher risk for feeling the brunt of the impacts of climate change. And again, the disproportionate burdens are endless. They are in the peer-reviewed literature. They are around us all the time. This is a report that I did with my friend Jackie Patterson at the Chisholm Legacy Project, how racism that appends the cradle, how Black children are differentially vulnerable to this endemic. We wrote this during the height of the pandemic, so economic disinvestment, COVID-19 pandemic, and climate change. And it's how a lot of our traditional lack of policy or very racist policies have also gotten us where we have been. And certainly this county feels this as well as other parts of the country. So this is just an example of what an average summer now looks like, or spring into fall summer. We don't really have seasons sometimes anymore. You're talking about triple digits. And we've heard from our panelists, these high rates of heat index certainly have lots of implications, including educational attainment. Can you focus when you're hot and bothered? I know I can't. And a lot of our schools, again, were never retrofitted to ever sustain the type of high humidity and lack of ventilation that they're forced to deal with now. And this is just, again, more and more. This was the Paradise Campfire in California in 2018. That's kind of when we first started seeing this more regular wildfire season type of situation. And a lot of us in public health started scratching our heads because there really was no guidance at the time. Is the air better inside the house or outside the house? What do we do with our dogs? What about pregnant moms? What do we do with our children? When should our schools open up? And this was just Bel Air and Sandy Point. So there's a lot of concerns here for sure. And you know what? I'm realizing this is not the right slide deck that was pulled up, but it's cool. We're going to work through it. I thought it was the right slide deck. It's okay. But there's a lot of impacts, obviously. Flooding. This was Puerto Rico. Power outages. I mean, on and on. And what we're not seeing is a decrease. We're only seeing an increase in these exposures. This was Maryland in 2024. We could have the same pictures in 2025. Sadly, you know, bridges that are collapsing, schools and childcare that are closed and never really able to open for a long time. That's small business, usually run by women and women of color. So the ripple effect of the impact on community by one small business closing and for the families who rely on them is huge. So children are vulnerable, right? Specifically, it's children and women across the world who are most vulnerable to the impacts of climate change. Casualties, injuries, trauma. So you may live through a major flood situation and maybe your family's lost your home or the school you love so much and to see your friends is gone and you don't know when it's going to open, but the trauma of what you've seen or maybe the injuries you sustained or the people you've lost around you, that is a serious component of generational impact. So there's a lot of mental health relationship here that we try to focus on. Water, food shortages, again, closed schools and childcare, and then what about the huge economic costs and stress on the family? Parents out of work, not able to provide for the family, kids feel that brunt of stress as well. So what's missing? We say that there needs to be an urgent focused attention to the implications to children, urgent connections to short and long-term health of children, and we need to make sure that our climate change policies, action policies, actually articulate vulnerable population like children and the way that they move around our society. They spend time in childcare, they spend time in K-12 schools, and then potentially college, and then a place of employment. If we follow their trajectory, we also need to make sure that climate adaptation and resilient solutions also are adopting to where children are spending the most time. So we're advocating for all kinds of solutions. Like I said, this was for a different talk. There's a lot of opportunities that I think we're going to get into now. We definitely have a call of action. We're running a children's environmental health movement. It's a big tent. We welcome and need everyone. We're hard pressed to find an area of society that does not include impacts to children, right? Transportation, our housing, obviously, like I said, our education components, our healthcare system. We need all hands on deck for sure. There are many co-benefits to climate strategies. Again, we don't have time, but I also call on inspiration often because I get up every day and wonder why an organization like ours even has to be in existence. And at the end of the day, I do know that all of us together are chipping away. We are making a difference. My encouragement would be that we go as deep as we possibly can. We have to not stop here. As you're hearing about all these stats, the wildfire season is only increasing more. And unfortunately not just from Canada in the West anymore. We're definitely having wildfires right here on the East Coast. Our waters are rising. We are definitely having rising heat. Every summer is expected to be warmer than the last one. So my part of inspiration today is called on by Mahatma Gandhi. The earth and the air and the land and the water are not an inheritance from our forefathers, but on loan from our children. So we have to hand them over to at least what was handed over to us. And I just encourage us to keep in the front of our minds, whether we're policy making, whether we're setting public health standards, how would that said policy or lack thereof, or how would that said climate adaptation effort impact children? And if we can't answer that question, we need to go back to the drawing board and figure it out. So thank you very much. I appreciate the time, and I hope we have a few more minutes for questions.
Thank you so much. I love that. And I think that's something that really resonates with me. Like in public health, we've been learning over the last 20, 30, 50 years that a lot of times zip code is more impactful on your health than genetic code. And you just can't separate these things. Environment, it just impacts so many things, and it's crazy. So with that, I'm going to selfishly steal the first question. Being from Iowa, that farm discussion really interested me, so I wanted to just hear a little bit more about what the Bloomin' PGC Urban Ag Initiative is and kind of how farmers are assisting in the implementation of the Climate Action Plan.
Yeah, happy.
And then we'll open it up for discussion. Oh, perfect.
Yeah, I think we have, you all can hear me? Okay, great. So I touched a little bit on the Bloomin' PGC Initiative, but essentially it was a collaborative group of organizations, led by the Food Equity Council and Eco City Farms, to really expand opportunities for people to grow food for community and in communities. It was also designed to help, kind of relieve some tax burden as well, like the property tax credit was something that was initiated by one of our former delegates, Mary Lehman. And so she wanted to incentivize urban farming, but then we found that urban farms could exist only in a few places. So just through the collaborative effort, again, we heard a lot about collaboration today, we were able to get the zoning passed to allow urban farm in almost every zone. The other part of it too was just working on some other uses, expanded opportunities for community gardens as well. Each year, the partners get together and they host what is called the Prince George's County Community Garden Summit. This past year was at the Sports and Learning Complex. So those are some of the initiatives that we're doing, and just trying to figure out what are some of the challenges for urban farmers. We know land access is a challenge, funding and infrastructure are all challenges for urban farmers to get started. So how can we as a collaboration support them? Because in the end, they're growing food for our community, and they're also implementing those conservation practices I spoke about that ultimately are helping with our goals in climate resiliency.
Yeah. All right, let's open it up. Who has a question? All right, your hand went right up.
Hello, my name is Effie Baldwin, and one of the speakers earlier today talked about Maryland, PG County had 60,000 acres of farmland. However, being in PG County, the quality of food that we sometimes get in our county and our grocery stores leads a lot of people to go over the bridge to Northern Virginia. What type of programs do we have where we can actually help stimulate those farmers and small, 5 acres and more, so that we can get CSAs where we can also stop with the greenhouse gases of going over the bridge and back versus in our community, since we do have 60,000 acres of farmland?
That's a great question. And I'll mention that we have 60,000 acres of farmland. 40,000 are privately owned, and then the rest is like Maryland National Capital Park and Planning Commission, I think, leases 1,200 tillable acres of farmland. So we do have a lot of opportunity. So a lot of times it's challenging. The aggregation and distribution network is a challenge, and that's one of the things that we're working with our partners. Right now, we at the Urban Farm Incubator, for example, trying to help those farmers get their products out can be challenging for them because sometimes it's a sole business, and so sometimes it's easier to work for them, like directly with a contract with a food bank, for example. I will mention there are a couple feasibility studies that are taking place in the county right now. One is for an Ag and Food Security Innovation Center that might look at some of the aggregation and distribution models so that we can feed more Prince Georgians with Prince Georgian farmers. There's also a county-owned food bank study that's happening, and then there's a county-owned grocery store feasibility study that's happening. So we're hoping that we can tie some of those feasibility studies together and that farmers are being included in that conversation. And we are definitely pushing for that at the Soil Conservation District and as the Bloom and PGC partnership. Hopefully that helps to answer it. But I can give you some CSAs to talk to about, okay?
A good question. All right, who's next? All right, I think you were first there.
Thanks for coming to me.
Yeah, no problem.
Hi, folks. Great presentations. My question is for Chief White. You know, I'm from Frederick County government, and we too have been grappling with some of the same kinds of things that you're talking about. And I'm curious, in your hazard mitigation and climate adaptation plan, have you pulled together partnerships on your flooding and heat impacts? And the reason why I'm asking that is because our municipal separate storm sewer system folks have to do flooding projects because of their state permit requirements. And we also have folks that are working on urban heat island effects and weatherization. And I'm just curious to see if you've started to have those conversations. I also wanted to just offer to connect you to our folks if you have any interest in that.
Well, thanks for the question. Because of this, the Interagency Climate Committee and this summit, the conversations have been started, but again, we did not have a good climate lens at all coming into this, right? Just, we see the data, you know, the boots on the ground, they're talking, man, we're getting a lot of these incidents, and we still didn't start, you know, the proper planning. The focus is on staffing, because we're in a crisis right now. We have been for quite some time. But what we have done is at least move resources around to the areas that need them more, and we've strategized in that way, but not necessarily focused on the infrastructure and partnering. So I definitely appreciate any info you could provide us so that I could pass it on to the operational deputy and get this thing going. But now the conversations have been started, so.
Well, it's important that you're honest, right, about where you're at. And I appreciate that a lot. We don't have a long way to go.
We do. Thank you.
And a connection there, opportunities for collaboration. That's like half of why we're here today. So I saw you were very enthusiastic earlier.
Hi, I'm VJ from the Rotary Clubs in the PG area. So I'm in College Park. So we started disaster aid 20 years ago with sending a truck to Katrina. So we see more and more of these happening, and we do training for disasters, and our kids and our people from high school, middle school, and college go to serve in deployments after getting trained. The more we do that, the more we integrate others. Food insecurity, we do electric food truck designs for innovation, and we also have in Rotary health and wellness for children. So Rotary is all over the world, global, but we are local and we do service projects, and we have been doing this training and we don't get the feedback that we should be getting.
Any comments to that, or we move down to the next question?
No, thank you very much, and it's a good reminder. Yet another reminder that might not be an obvious partner that many of us should be connecting with, so thank you very much.
Thank you. Great presentations, everybody, and thank you for all of your excellent work. I'm Greg Smith. I serve on the board of Sustainable Hyattsville, and I'll just direct my question to Chief White. Last year, we were trying to get access to fire and response and police response data. These reports are supposed to be provided monthly by law to the planning director, but could not find that information at all for either department. I'm wondering if the department would commit to posting those reports online so that communities can see what the trends are in response times and staffing, so that we can advocate for whatever you need to give us more qualified firefighters. And second, related to something you said, you put out the numbers about what kind of precipitation increases we are projected to get between 2050 and 2079. And I'm pretty familiar with that. I'm also familiar with the fact that the county has been quite far behind in upgrading its stormwater management and floodplain standards to the point that we're kind of catching up now, but I don't see any evidence that our standards right now take into account what you know is projected to come. So in this all hands on deck scenario, what role do you see the fire department and other first responders playing in pushing the county, especially planning and our decision makers, to start taking climate change into account seriously? Because on the West Hyattsville Queens Chapel sector plan, planning staff recommended a prohibition on building in floodplains, but the plan was remanded back with the director to say, give us creative ways to build in floodplains, which struck me as a little bonkers. But the two questions: the response time and staffing data being made more publicly available, and second, what role do you see the fire department being able to play in helping to move our standards towards greater climate resiliency? Thank you.
Yeah, thank you for the question. One of the committee members actually from the Department of Environment asked the same question about sharing data. We recently, so the data analyst who provided this, he's maybe been with us for a year. So that was one step that the fire department has taken, is to be able to get not only get the data that we track with our systems, but to have someone analyze it and prepare reports both for the county administration and for the public. So that is something, I don't have a timeline on that, but he is, based on her question to him, he is working on getting approval to not only share the data with their agency, but also segue into just having that information available to whoever wants to see it. So making that more publicly available. And also, that being said, with this information going to the fire chief, making her aware, and her conversations with the county executive, we can get the funding to get the people and get the resources. We can say what we need infrastructure-wise, but from the fire department standpoint, we could at least have the people to respond, the resources to respond, and have them placed in the proper areas, because we are able to see hot spots on certain call types. So obviously, the closer you get to the waterways, to the Potomac, to some of the bays, Eagle Harbor, you're going to have the water rescues and the flooded roads, things that our infrastructure was just barely able to accommodate previously, but now it's the slightest rain is flooding the roads because the water levels have risen. So anyway, getting those resources in the right places so we can respond quickly before conditions get too bad. And so those are the two things that hopefully that answered the two questions. But we are working on making the data more readily available. We've just transitioned to a new fire incident reporting management system, image trend. So we're trying to, that'll be better for us to be able to further analyze the data. So we are taking some steps to actually, again, modernize and make use of the programs we're spending money on.
Some really good questions today, and we have just a couple minutes left. The perks of being moderator, I'm also going to steal the last question because I was really looking to hear more about kind of the approaches that we would need to, when talking about vulnerable populations, and what kind of some of the biggest impacts are on those vulnerable populations. So, Nsedu, I think you would have an insight there.
Sure, thank you. So like I mentioned, making sure that we're very specific about the type of vulnerable populations we are trying to support. That is not prevention, but that's what people need right now. So that's the adaptation side of it. We got to do both. People need help right now. People will continue to need help as more of these weather events and other impacts from climate change happen. We can't just kick the can down the road, but we also don't want that to be our solution. So children, pregnant mothers, those that care for children and vulnerable populations, seniors, immunocompromised need to be articulated very well, and we need to backtrack it. What happens when people can't get their medicine? And I'm including young people now, right? When that whole system is disrupted, we've had too many accounts where people just didn't think of that. It wasn't thought of in the plan before we got into the crisis mode. Again, if it's not in the plan, it's not going to be part of funding. And I applaud PG County Schools for having a climate action plan. A lot of school districts do not have a plan. Again, we can't stop there, though. We got to keep refining. As we go through different incidences, we heard about the increase in mold and mildew. There isn't any regulatory body that can come in and close down a school, if you will, for mold. It's kind of one of those things that has to be addressed, and there's appropriate ways to do it, right? And that goes back to regular environmental management, your ventilation system. So basic maintenance goes a long way, helping to make sure that HVAC systems, schools, childcare, again, workplaces, people where we all spend a lot of indoor time in, is not causing harm and unfortunately not very vulnerable when a major disaster or crisis happens. Our vote matters. Who we elect is extremely vulnerable and important. I don't know that we would maybe, but I think we had this summit because we had a lot of incredible leadership in the county make it happen. We have to be very explicit about who we're voting into office. So first, number one, vote. We're nonpartisan. I'm not going to tell you who to vote for. But number two, look up and do your homework. Start asking questions, right? Climate change is going to be a part of our life. How will elected officials get serious about making a primary focus? And that means everyone gets protected, including vulnerable populations. And then finally, I'll just say, consider again, many different places where we can all have influence. We have to make sure we're not just talking to the same people. I've mentioned childcare about 6 or 7 times. We have an eco-healthy childcare program. It's the only program in the country working to train and educate childcare professionals. Again, they're an incredible foundation to our society. We learned during COVID, if childcare is not open, safe and affordable and healthy, people can't go to work. When Head Start was closed, because the government was closed, 70,000 kids had nowhere to go. Where do those families go? Not everyone can work from home and work effectively. So we have to make sure that the major components of where child development is a part is also part of these action plans, is also giving us real realities of the challenges so we can overcome them, and is also not lost in translation.
Nothing like wrapping up with a call to action. So thank you, speakers. Excellent. Love to hear. Thank you, audience, for attending. Thank you for the great questions, and just ask that you keep this energy up. This is the one-day summit, but we need to do this 365 days a year, not just today. And with that, we'll wrap up and let everybody get to their last session. Thank you.